101. Which of the following medications is commonly used for topical treatment of rosacea? A. Tretinoin. B. Metronidazole. C. Hydrocortisone. D. Clindamycin. Answer: B. Metronidazole. Rationale: metronidazole is a commonly prescribed topical treatment for rosacea due to its anti-inflammatory and antimicrobial properties. 102. Which of the following is most important for rosacea patients to avoid? A. Over-the-counter moisturizers. B. Sun exposure without sunscreen. C. High-fiber foods. D. Regular exercise. Answer: B. Sun exposure without sunscreen. Rationale: sun exposure is a major trigger for rosacea flare-ups, so it is critical for patients to use sunscreen and avoid prolonged sun exposure. 103. A patient with rosacea is prescribed oral doxycycline. What should the nurse instruct the patient regarding this medication? A. Take the medication with food to avoid stomach irritation. B. Take the medication before meals for better absorption. C. Drink large amounts of water to prevent dehydration. D. Apply the medication directly to the affected skin. Answer: A. Take the medication with food to avoid stomach irritation. Rationale: doxycycline can irritate the stomach, so it is recommended to take it with food or a full glass of water to minimize gastrointestinal discomfort. 104. Which of the following is a typical symptom of ocular rosacea? A. Blurry vision. B. Eye redness and dryness. C. Rapid eye movement. D. Double vision. Answer: B. Eye redness and dryness. Rationale: ocular rosacea affects the eyes, causing symptoms like redness, dryness, and irritation. 105. Which of the following statements about rosacea is correct? A. Rosacea is caused by poor hygiene. B. Rosacea only affects older adults. C. Rosacea can be triggered by stress and certain foods. D. Rosacea is contagious. Answer: C. Rosacea can be triggered by stress and certain foods. Rationale: stress, spicy foods, and alcohol are common triggers for rosacea flare-ups. The condition is not caused by poor hygiene, and it can affect individuals of various ages. 106. Which of the following best describes the pathophysiology of rosacea? A. Inflammation of the sebaceous glands leading to acne-like lesions. B. Autoimmune reaction that affects blood vessels in the face. C. Increased production of skin oils causing clogged pores. D. Abnormal immune response leading to chronic redness and swelling. Answer: D. Abnormal immune response leading to chronic redness and swelling. Rationale: rosacea is characterized by chronic redness, visible blood vessels, and inflammation, often due to an abnormal immune response. 107. Which of the following is a first-line treatment for rosacea? A. Oral antibiotics. B. Topical metronidazole. C. Laser therapy. D. Oral corticosteroids. Answer: B. Topical metronidazole. Rationale: topical metronidazole is often used as a first-line treatment for rosacea, particularly for reducing inflammation and redness. 108. What should be considered when using oral antibiotics for rosacea? A. They are the first choice for all patients with rosacea. B. They are only prescribed for mild cases of rosacea. C. They are typically used for moderate to severe cases. D. They should be used long-term for maintenance. Answer: C. They are typically used for moderate to severe cases. Rationale: oral antibiotics like doxycycline are typically used for moderate to severe cases of rosacea, particularly when topical treatments are not effective. 109. What is one of the most common visible signs of rosacea? A. Scaly, flaky skin patches. B. Yellowish-green pustules. C. Persistent facial redness. D. Severe swelling of the cheeks. Answer: C. Persistent facial redness. Rationale: persistent facial redness is one of the hallmark symptoms of rosacea, often accompanied by visible blood vessels, telangiectasia. 110. Which of the following is a non-pharmacological approach to managing rosacea? A. Regular use of topical steroids. B. Trigger avoidance, including sun protection. C. Frequent facial exfoliation. D. Daily application of makeup. Answer: B. Trigger avoidance, including sun protection. Rationale: Avoiding triggers such as sun exposure, stress, and certain foods is an important non-pharmacological approach to managing rosacea. 111. Which of the following can be a complication of untreated rosacea? A. Permanent scarring. B. Permanent hair loss. C. Widespread body rashes. D. Severe acne cysts. Answer: A. Permanent scarring. Rationale: if left untreated, rosacea can lead to permanent skin changes, including scarring, especially in more severe cases like rhinophyma. 112. What is the primary concern when prescribing corticosteroids for patients with rosacea? A. Risk of exacerbating symptoms and worsening the condition. B. Risk of immediate allergic reactions. C. Risk of skin thinning with long-term use. D. Risk of overgrowth of facial hair. Answer: A. Risk of exacerbating symptoms and worsening the condition. Rationale: corticosteroids can exacerbate rosacea symptoms, leading to worsening of the redness and inflammation. They are generally avoided or used cautiously in rosacea management. 113. Which of the following is the most likely reason a patient with rosacea may develop rhinophyma? A. Excessive exposure to sunlight. B. Long-term use of oral antibiotics. C. Chronic inflammation leading to skin thickening. D. Genetic predisposition. Answer: C. Chronic inflammation leading to skin thickening. Rationale: rhinophyma, which involves thickening of the skin on the nose, is often a result of chronic inflammation and untreated or poorly controlled rosacea. 114. What is a key recommendation for patients with rosacea regarding skincare products? A. Use harsh exfoliants to remove dead skin cells. B. Choose fragrance-free and alcohol-free products. C. Select products with high alcohol content to control oil. D. Avoid using sunscreen, as it may irritate the skin. Answer: B. Choose fragrance-free and alcohol-free products. Rationale: patients with rosacea should avoid products containing alcohol or fragrances, as these ingredients can irritate the skin and worsen symptoms. 115. Which of the following is the first-line treatment for ocular rosacea? A. Oral steroids. B. Warm compresses and eyelid hygiene. C. Oral doxycycline. D. Surgical intervention. Answer: B. Warm compresses and eyelid hygiene. Rationale: the first-line treatment for ocular rosacea involves warm compresses and proper eyelid hygiene to manage eye irritation and dryness. 116. A patient is using metronidazole cream for rosacea and notices skin irritation. What is the most appropriate recommendation? A. Discontinue the cream and switch to oral antibiotics. B. Continue using the cream but reduce the frequency of application. C. Apply the cream only on specific areas of the face. D. Switch to a stronger topical treatment. Answer: B. Continue using the cream but reduce the frequency of application. Rationale: if skin irritation occurs, it is often helpful to reduce the frequency of application to allow the skin to acclimate. Discontinuing treatment should be considered if irritation persists. 117. Which of the following types of sunscreen is recommended for people with rosacea? A. Oil-based sunscreens. B. Sunscreen with SPF 15 or lower. C. Fragrance-free and broad-spectrum sunscreens with SPF 30 or higher. D. Tinted sunscreens to cover redness. Answer: C. Fragrance-free and broad-spectrum sunscreens with SPF 30 or higher. Rationale: fragrance-free, broad-spectrum sunscreens with an SPF of at least 30 help protect the skin from UV rays and prevent rosacea flare-ups triggered by sun exposure. 118. Which of the following conditions can be mistaken for rosacea due to similar symptoms, such as facial redness? A. Psoriasis. B. Acne vulgaris. C. Lupus erythematosus. D. Seborrheic dermatitis. Answer: C. Lupus erythematosus. Rationale: lupus erythematosus can cause a characteristic butterfly-shaped rash on the face that may resemble the redness seen in rosacea. A thorough evaluation is necessary for an accurate diagnosis. 119. What is the best strategy to prevent the progression of rosacea? A. Avoiding all forms of skincare. B. Consistently using prescribed medications and avoiding triggers. C. Using high-dose oral antibiotics indefinitely. D. Avoiding all sun exposure. Answer. B. Consistently using prescribed medications and avoiding triggers. Rationale. The best way to manage rosacea is to consistently use prescribed treatments and avoid triggers that can lead to flare-ups, such as sun exposure or certain foods. 120. Which of the following is a psychological impact commonly experienced by patients with rosacea? A. Anxiety and social embarrassment due to visible facial redness. B. Increased self-esteem and confidence. C. Decreased risk of depression. D. Feelings of frustration due to hair loss. Answer. A. Anxiety and social embarrassment due to visible facial redness. Rationale. The visible symptoms of rosacea, especially facial redness, can lead to anxiety, self-consciousness, and social embarrassment, which may affect a patient's emotional well-being. 121. A patient with rosacea is experiencing significant flushing and blushing. Which of the following triggers should be addressed in their care plan? A. Increased humidity. B. Emotional stress and hot beverages. C. Physical inactivity. D. Low-fat diet. Answer. B. Emotional stress and hot beverages. Rationale. Emotional stress and hot beverages are common triggers for flushing in patients with rosacea. Identifying and avoiding these triggers can help reduce symptoms. 122. Which of the following conditions may rosacea be mistaken for due to similar symptoms of facial redness and papules? A. Dermatitis herpetiformis. B. Acne vulgaris. C. Actinic keratosis. D. Vitiligo. Answer. B. Acne vulgaris. Rationale. Rosacea and acne vulgaris share common symptoms such as papules and redness, making it necessary for healthcare providers to differentiate between the two for appropriate treatment. 123. Which of the following is the most appropriate action for a nurse to take when caring for a patient with ocular rosacea? A. Recommend a steroid eye drop for inflammation. B. Encourage the patient to use artificial tears to relieve dryness. C. Advise the patient to avoid wearing glasses. D. Suggest using a warm compress only when symptoms worsen. Answer. B. Encourage the patient to use artificial tears to relieve dryness. Rationale. Ocular rosacea can cause dryness and irritation in the eyes. Artificial tears help alleviate these symptoms and provide comfort. 124. What type of skincare products should be recommended for a patient with rosacea to avoid irritation? A. Products containing alcohol and fragrances. B. Oil-based products that help soothe the skin. C. Astringents to reduce redness. D. Fragrance-free and gentle moisturizers. Answer. D. Fragrance-free and gentle moisturizers. Rationale. Fragrance-free, gentle moisturizers are ideal for patients with rosacea as they help hydrate the skin without triggering irritation. 125. What is a common symptom of rosacea that can be worsened by exposure to heat or alcohol? A. Pimples and pustules. B. Excessive dryness of the skin. C. Blurred vision. D. Facial flushing and redness. Answer. D. Facial flushing and redness. Rationale. Exposure to heat, alcohol, and certain foods can cause facial flushing and redness, common symptoms of rosacea. Avoiding these triggers is important for managing the condition. 126. What is the role of laser therapy in the treatment of rosacea? A. To treat the underlying infection causing rosacea. B. To improve blood circulation in the affected areas. C. To reduce visible blood vessels and redness. D. To promote collagen production and skin healing. Answer. C. To reduce visible blood vessels and redness. Rationale. Laser therapy is used in rosacea to target and reduce visible blood vessels, telangiectasia, and persistent redness, improving the appearance of the skin. 127. A patient with rosacea is prescribed topical ivermectin. What is the expected outcome of this treatment? A. Reduction of inflammation and improvement in skin texture. B. Cure of the condition after several applications. C. Significant decrease in the size of pores. D. Complete elimination of redness. Answer. A. Reduction of inflammation and improvement in skin texture. Rationale. Topical ivermectin helps reduce inflammation and improve the skin's texture by addressing the inflammatory component of rosacea. 128. Which of the following is a psychological effect that patients with rosacea may experience? A. Increased levels of happiness and self-esteem. B. Chronic embarrassment or social anxiety. C. Disinterest in personal appearance. D. Reduced risk of depressive symptoms. Answer: B. Chronic embarrassment or social anxiety. Rationale: the visible signs of rosacea, such as persistent redness and papules, can cause chronic embarrassment or social anxiety, affecting patients' emotional well-being. 129. What is the primary function of topical metronidazole in the treatment of rosacea? A. To relieve dry skin. B. To reduce redness and inflammation. C. To prevent the development of cysts. D. To lighten hyperpigmentation. Answer: B. To reduce redness and inflammation. Rationale: topical metronidazole is an anti-inflammatory medication that helps reduce redness, inflammation, and the number of pustules associated with rosacea. 130. When educating a patient with rosacea on lifestyle modifications, what should be emphasized? A. Avoiding excessive sun exposure and using sunscreen. B. Increasing intake of spicy foods to improve skin tone. C. Washing the face multiple times a day to control oil. D. Applying harsh scrubs to exfoliate the skin. Answer: A. Avoiding excessive sun exposure and using sunscreen. Rationale: sun exposure is a significant trigger for rosacea flare-ups, so patients should be educated on the importance of sun protection to prevent exacerbation of symptoms. 131. What is the most appropriate first-line treatment for mild to moderate rosacea? A. Oral antibiotics like doxycycline. B. Topical metronidazole or azelaic acid. C. Laser therapy. D. Topical corticosteroids. Answer: B. Topical metronidazole or azelaic acid. Rationale: topical metronidazole and azelaic acid are considered first-line treatments for mild to moderate rosacea due to their anti-inflammatory and antimicrobial properties. 132. What is the effect of excessive alcohol consumption on a patient with rosacea? A. It helps to reduce redness and improve skin texture. B. It has no effect on rosacea symptoms. C. It can worsen facial redness and flushing. D. It reduces the likelihood of flare-ups. Answer: C. It can worsen facial redness and flushing. Rationale: alcohol is a common rosacea trigger, often worsening symptoms such as facial redness and flushing. Patients with rosacea should limit alcohol intake. 133. How does oral doxycycline help manage rosacea? A. By promoting skin exfoliation and reducing pore size. B. By decreasing bacterial load in the skin. C. By reducing inflammation and controlling outbreaks. D. By improving the production of collagen. Answer: C. By reducing inflammation and controlling outbreaks. Rationale: oral doxycycline is an antibiotic with anti-inflammatory properties, commonly used for moderate to severe rosacea to reduce inflammation and prevent flare-ups. 134. Which of the following should be avoided by a patient with rosacea to minimize flare-ups? A. Using non-comedogenic makeup. B. Exposure to cold weather. C. Exposure to hot, humid environments. D. Use of gentle skincare products. Answer: C. Exposure to hot, humid environments. Rationale: hot and humid environments can trigger rosacea flare-ups. Patients should avoid heat exposure and keep their environment cool and dry. 135. Which of the following is a benefit of laser treatment in rosacea management? A. Decreases pore size. B. Eliminates the need for all medications. C. Reduces visibility of telangiectasia and redness. D. Cures rosacea completely. Answer: C. Reduces visibility of telangiectasia and redness. Rationale: laser treatment helps target and reduce visible blood vessels, telangiectasia, and redness associated with rosacea, improving the appearance of the skin. 136. Which of the following is the most common cause of an acute rosacea flare-up? A. Lack of sleep. B. Exposure to sunlight or extreme temperatures. C. Poor diet and high sugar intake. D. Application of harsh skincare products. Answer. B. Exposure to sunlight or extreme temperatures. Rationale. Sun exposure and extreme temperatures are the most common triggers for acute rosacea flare-ups, leading to increased redness and inflammation. 137. What should be recommended to a patient with rosacea who is experiencing symptoms in the eye area? A. Apply topical steroids to the eyelids. B. Avoid contact with water. C. Use warm compresses and consider eyelid hygiene. D. Avoid using sunscreen on the face. Answer. C. Use warm compresses and consider eyelid hygiene. Rationale. Ocular rosacea affects the eyes and eyelids, and using warm compresses and practicing eyelid hygiene can help relieve symptoms like dryness and irritation. 138. What is a potential long-term complication of untreated rosacea? A. Chronic sunburn. B. Rhinophyma, or thickening of the skin on the nose. C. Chronic acne scarring. D. Development of eczema. Answer. B. Rhinophyma, or thickening of the skin on the nose. Rationale. Rhinophyma, the thickening of the skin on the nose, is a potential long-term complication of untreated rosacea, particularly in severe cases. 139. Which of the following should be avoided in the skincare routine of a patient with rosacea? A. Use of sunscreen. B. Gentle moisturizing products. C. Exfoliating scrubs and harsh toners. D. Mild, non-soap cleansers. Answer. C. Exfoliating scrubs and harsh toners. Rationale. Exfoliating scrubs and harsh toners can irritate the skin, exacerbating rosacea symptoms. Gentle, non-irritating products are recommended instead. 140. A patient with rosacea has noticed their symptoms worsening in the winter. Which of the following is the best recommendation to help manage symptoms? A. Use a humidifier to prevent skin dryness. B. Avoid wearing scarves and hats. C. Expose the face to sunlight for short periods. D. Use a topical steroid cream for irritation. Answer. A. Use a humidifier to prevent skin dryness. Rationale. Cold weather and indoor heating can lead to skin dryness, which can worsen rosacea. Using a humidifier helps maintain moisture in the air, preventing skin dehydration. 141. A patient with rosacea is experiencing worsening of symptoms in response to certain foods. Which of the following is a common dietary trigger for rosacea flare-ups? A. Spicy foods. B. High-protein foods. C. Dairy products. D. Caffeinated beverages. Answer. A. Spicy foods. Rationale. Spicy foods are a common trigger for rosacea flare-ups. Patients should be advised to avoid these to reduce the risk of exacerbating symptoms. 142. Which of the following is a characteristic symptom of rosacea that distinguishes it from other skin conditions? A. Presence of comedones, blackheads and whiteheads. B. Chronic dry patches on the skin. C. Persistent redness and visible blood vessels. D. Severe peeling of the skin. Answer. C. Persistent redness and visible blood vessels. Rationale. Persistent redness and visible blood vessels, telangiectasia, are hallmark symptoms of rosacea, distinguishing it from other skin conditions. 143. What is the most likely cause of rosacea? A. Viral infection. B. Allergic reaction. C. Genetic predisposition and environmental factors. D. Overuse of harsh skin products. Answer. C. Genetic predisposition and environmental factors. Rationale. The exact cause of rosacea is unclear, but it is believed to result from a combination of genetic factors and environmental triggers, such as sun exposure or hot weather. 144. What is a key nursing intervention for a patient with rosacea who is experiencing ocular involvement? A. Provide antibiotics to treat the infection. B. Recommend frequent eye lubrication with artificial tears. C. Suggest the use of cold compresses to reduce swelling. D. Instruct the patient to avoid wearing glasses. Answer. B. Recommend frequent eye lubrication with artificial tears. Rationale. Ocular rosacea often causes dryness and irritation, so the use of artificial tears helps lubricate the eyes and provide relief. 145. Which of the following medications is commonly used to treat moderate to severe rosacea by reducing inflammation? A. Oral tetracycline antibiotics. B. Topical corticosteroids. C. Oral isotretinoin. D. Topical benzoyl peroxide. Answer. A. Oral tetracycline antibiotics. Rationale. Oral tetracycline antibiotics, such as doxycycline, are commonly used for moderate to severe rosacea due to their anti-inflammatory properties. 146. When a patient with rosacea reports frequent facial flushing, which of the following should the nurse suggest as a potential trigger? A. Exposure to cold air. B. Physical exertion and emotional stress. C. Eating a high-fiber diet. D. Frequent hand washing. Answer. B. Physical exertion and emotional stress. Rationale. Emotional stress and physical exertion are common triggers for flushing in patients with rosacea, and the nurse should encourage the patient to manage these triggers. 147. A nurse is providing care for a patient with rosacea. Which of the following is an important aspect of educating the patient about managing their condition? A. Recommend using aggressive skincare products to reduce symptoms quickly. B. Advise avoiding skin triggers and sun exposure. C. Instruct the patient to avoid using sunscreen. D. Suggest using heavy makeup to hide redness. Answer. B. Advise avoiding skin triggers and sun exposure. Rationale. Educating the patient to avoid skin triggers, including sun exposure, is essential for managing rosacea symptoms. Sunscreen use is encouraged, not avoided. 148. Which of the following is a common co-occurring condition with rosacea? A. Eczema. B. Acne vulgaris. C. Psoriasis. D. Lupus erythematosus. Answer. B. Acne vulgaris. Rationale. Rosacea can often be confused with acne vulgaris due to similar symptoms, such as pimples and pustules. However, the underlying causes and treatment approaches differ. 149. A nurse is caring for a patient with rosacea. Which of the following should the nurse advise the patient to avoid to prevent worsening symptoms? A. Gentle facial cleansing with water only. B. Long hot showers and facial scrubbing. C. Using a humidifier in the home. D. Applying mild moisturizers to the skin. Answer. B. Long hot showers and facial scrubbing. Rationale. Long hot showers and facial scrubbing can irritate the skin and exacerbate rosacea symptoms, so these activities should be avoided. 150. A nurse is teaching a patient about the use of topical medications for rosacea. Which of the following should be included in the teaching plan? A. Apply the medication only once a week. B. Use sunscreen daily while using topical medications. C. Avoid all moisturizers while on treatment. D. Apply the medication only when symptoms are severe. Answer. B. Use sunscreen daily while using topical medications. Rationale. Patients using topical medications for rosacea should use sunscreen daily to prevent sunburn and further irritation of the skin.